Hello, everybody. I'm Dr. Murphy. I am the Visiting Scholars Program Director here at Arkana Labs, and I'm here to just answer a few questions about what a visit is like here, as well as the award that we offer regarding visits here at Arkana Labs. Here at Arkana, we offer 2 awards per year. Basically, the idea behind the award is we cover the cost of travel as well as the cost of housing, while the awardees are here to learn and kind of rotate with us. In addition to that, the award also comes with a renal textbook, as well as a slight stipend as well for winning the award here at Arkana. The renal rotation is actually very flexible. So one of the things that we understand here at Arkana is that pathology residents, depending on the program that they're in, may not have a ton of flexibility, from week to week, month to month, that kind of thing, as most programs set up their basically set their resident schedules up in July for the entire year. So once people know that they have an elective month or something like that, or a few weeks, they like to take advantage of that. So here at Arkana, we try to be as flexible as we can, and we hope to see you for at least 2 weeks, but we also offer, optimally a four-week or a month-long rotation with us. But at the same time, I myself specifically rotated, for 2 weeks. So I think under 2 weeks is you don't really get to see enough, but I think we can definitely be flexible between 2 to 4 weeks, depending on what the awardee has available to them. We're looking for U.S. trained AP or APCP residents, specifically PGY 1s through 3, basically those that haven't already decided on a fellowship to apply. Regarding the application requirements for the award, feel free to visit our website at arkanalabs.com. Under the education tab, you can go down and view kind of the application itself, as well as those requirements. The application requirements would include there's a letter of recommendation, as well as a narrative just kind of on why this experience is desired, why you would like to rotate with us, what you hope to gain, those sorts of things. But we do like to keep it kind of broad and just let you speak freely about why this might enhance your learning, or why you're interested in this opportunity. The ideal candidate that we're looking for is somebody who's intellectually curious. Somebody that is always kind of asking questions, or kind of renal is kind of a niche specialty within the world of pathology. Somebody that's obviously hardworking, motivated, but at the end of the day, going back to the niche aspect of renal pathology, somebody that's still kind of open-minded to maybe a field that they really haven't dove into much in their current training. Part of pathology residency, it's full of surgical pathology, clinical chemistry, and all those things if you're doing AP and CP, and sometimes kidney is pushed to the side, or some places don't even have renal pathology. So just somebody who's really looking at other fields, or is interested in some of these niche areas, and somebody who's just looking to learn a little bit more about kidney pathology. By no means is it a requirement to come and do a rotation here at Arkana in order to be accepted for a fellowship position. But at the same time, it is an opportunity, just more so just for you as it is for us, just to kind of get an opportunity to get to know you, and get an opportunity to kind of teach you about renal pathology, and make sure that maybe this is, if you're interested in the fellowship, that this is truly um, a path that you're interested in taking. Yeah, so our typical day for an awardee would be we start our day basically at our conference at 8:30 in the morning, and that's our daily case conference. So um, that's an opportunity for all of the renal pathologists here to bring interesting cases, difficult cases, sometimes just good teaching cases to our conference, and we go over those. And it's really an opportunity to get to sit in a room of 20 to 25 experts in renal pathology, and not only does the awardee learn about the cases, but you also we as the attending physicians also, it's our opportunity to kind of learn from each other. um, you know as so many my mentors always said, when you're getting into medicine, um, it's really about lifelong learning, and so this is one of those opportunities for me to still kind of sharpen my sword, as they say, and can you continue to learn and just get better as a pathologist. So that's kind of the beginning of the day, and then right after that, typically we'll have a daily lecture for the awardee, which is given by one of our 20 to 25 expert pathologists. All have kind of little interests in different aspects of renal pathology, and so they'll have the opportunity to have lectures from C3GN to IgA to transplant, different aspects of rejection, lots of different lectures to really get into the nitty-gritty details of some of these diseases in renal pathology. And then as the day progresses, we do have a little bit of a kind of a break there in the middle of the day for independent learning, where they have the opportunity to go through pooled cases on their own, and kind of formulate questions if they have any. And then in the afternoon, me and a few of the other pathologists get the opportunity to sit down with them and actually have one-on-one kind of scope time to go over interesting cases, or cases they have questions on, and just further learn about renal. And that usually kind of wraps up the end of the day. And so yeah, that's kind of what the day looks like. One of the things that's nice about the awardees rotation while they're here with us is that we have the ability to be very malleable, or kind of flexible with their day. So while there is some structure to it, if they have particular interests, i.e. if they have an interest in research, we do have avenues that are available for them to work with some of our research physicians, working on anything from a case series to even some more potentially most of it's clinical pathologic research, but we also have other potential opportunities for research, and they can get as hands-on as they would like to, or not, if research isn't their specialty. The culture here at Arkana is a very collegial and fun atmosphere. So I've been blessed along my path to have worked with lots of great pathologists and great people, and Arkana is no exception to that. So while we do work hard, and really the patient, we are very patient centered, and our patients come first here. We always do it kind of with a smile on our face, and everyone always has great attitudes and likes to kind of have fun at the same time. So it's just this awesome kind of place to work and experience. It's somewhat unlike any other place, just because we're here. So Little Rock's a great town. It's the capital of Arkansas here, and we have lots of opportunities here for lots of interests. So there's a great restaurant scene here. There's really something for everybody. We have sports, we have theater. There's great music here. Anything and everything you can pretty much think of, you could probably find it here in Arkansas. So our current application deadline is actually September 1st. So if you have any additional questions or concerns regarding the application or the award or the opportunity here, feel free to email me at visitors@arkanalabs.com, as well as feel free to go to the website at arkanalabs.com, go to the education tab, and then just scroll down, and it will give all the specifics about the application and the award. And hope to see you guys soon.